Michael Barnes here. I'm a board-certified psychiatrist. Today we're going to go over benzodiazepines, which include medications like Xanax, Ativan, Klonopin, Valium, and others. As a psychiatrist, I certainly feel well positioned to talk about these medications. I do prescribe them. Me personally, I tend to have kind of a love-hate relationship with this group of medications. So what I'll try to do today is talk about all the good and all the bad that come with these medications. So here we go. First off, what are benzodiazepines? What they are central nervous system depressants. And what does that mean? That means these are medications that go to the brain and tone down the brain and calm them down so that people can feel better. And before we talk about all the negative baggage that comes with this medication, let's first talk about the good. Personally, these medications tend to be very effective at treating anxiety and panic attacks. They tend to work very quickly, usually within an hour of taking them, as opposed to other medications that have to be taken daily and accumulate in the body in order to work. These medications work fast. These meds are also immensely effective at treating things like racing thoughts, agitation, and even mania. And when you speak to folks who struggle with panic attacks or any of the other things that I've mentioned, they will often tell you that these benzodiazepines are one of the few things that give them any form of relief. But what about the negatives? For one, these medications do tend to be addictive, actually in a similar way that alcohol is addictive. Number two, long-term chronic use of these medications has now been shown to be correlated with an increased risk of developing dementia like Alzheimer's. Another negative of these medicines are that if you are on them daily and want to come off of them, you have to come off of them very carefully, and if done incorrectly, can actually hurt the brain. Another thing to consider when taking a medicine like this is that it can be deadly when mixed with other central nervous system depressants like alcohol or opiates and other things. So for me, I do try to avoid prescribing benzodiazepines if possible, but when I do use them, I try to use them as needed and explain all of the risks and the benefits. I like prescribing them to folks so that they could use it during very specific times, like if you have a fear of flying, for example, or if you have to give a presentation at work or some other event. So of course these medications are not for everybody, but a savvy psychiatrist should be able to tease out who is appropriate for these group of meds.